Okay, good afternoon, folks. We're going to go ahead and get started. Thanks for joining us for the webinar today. We're going to be going through some of the things that the California Coalition on Workers' Compensation is working on in the legislative process this year, giving a little bit of political context, if you will, to help understand what's going on, and then ultimately trying to show you some tricks of the trade, how you can get involved, how you can track information, kind of what resources are available to you. There is, in your webinar module over to the right of your screen, there is a chat function. If you have any questions, go ahead and type your question into the chat module, questions into the chat module, and click send, and we'll collect them and respond to them. Maybe during the presentation, maybe at the end of the presentation we'll go through it. Just depends on how things are going. So that's that, and with that we'll go ahead and get started. Okay. So 2015 legislative session is up and started. It really started in January of this year, December really if you're being technical. A quick landscape assessment. What's going on in California politically? It's pretty simple. Governor Brown is in firm control of what goes on in the state. He's largely considered to be the adult in the room. You know, the old-time politician that has been in almost every level of government at this point. He's got a lot of seasoning behind him as a mayor, as a governor, as an attorney general, and more. He's really, you know, cut his teeth in a lot of different areas. You know, the legislature attempting to deal with somebody like this in the term-limited era, they're really at a disadvantage. His strategic know-how and the team he's assembled, frankly, is in firm control, and more control than I'd say any governor in a few decades. The State House, the legislature, the Assembly, and the Senate are all firmly controlled by Democrats. This last election cycle, there were a couple of changes. Democrats lost a few seats. They lost their two-thirds supermajority, but they are still firmly in control of the House, both houses. Really, the only change was, you know, losing the two-thirds and the ability to make procedural moves during the legislative session, you know, without asking Republicans for votes. I mean, really, that's the only material change in the politics of the legislature. Like I said, there are term limits. There have been recent changes in term limits, some that I think will be very beneficial to the employer community as we kind of grapple with some of these issues around workers' comp insurance. Previously, legislators were limited to 6 years in the Assembly and 8 years in the Senate. What they've gone and done is change that to 12 years in either house of the legislature. The good news is that means that most Assembly members won't be leaving after 6 years. They'll be around for longer than that. The benefit to you is that when we go around and we teach them about the issue, they actually have some time to apply what they've learned instead of essentially learning and then terming out. And that's a little bit of the political landscape for you. Okay. As I mentioned, bicameral legislature. There's an Assembly, there's a Senate, a lower house, and an upper house. The Assembly has 80 members. They are 2-year terms. The Senate has 40 members. They are 4-year terms. As I indicated, there are some changes in term limits that we already talked about. The legislative leadership, it's an important thing to understand, partially because politics is regional, right, and local, and to the extent that you are in any of these districts or have a relationship with any of these folks, you want to know that, especially as we're going about trying to impact the legislative process. So in the Assembly, we have the Speaker, Toni Atkins from San Diego. She's a short-term leader. She's termed out in a little under 2 years. So she's kind of a placeholder speaker, if you will. The next speaker, who knows who it will be. The same is also true of the minority leader in the Assembly, Kristen Olson. She terms out in 2016. You're starting to see, if you look over to the Senate side, a little bit of a trend. Bob Huff also terms out in 2016. Gene Fuller, a Republican from the Bakersfield area, Kern County, is following Bob as minority leader in the Senate. And then, of course, in the Senate, you have President Pro Tem Kevin De Leon. He does not term out in 2016. He could actually be around for quite a while. But I would say he is the only one of the 4 leaders that is challenged within his caucus, meaning that he has somebody or maybe a few somebodies that want his job for themselves and aren't being subtle about it. So I think the big picture is there could be a lot of turnover in legislative leadership over the next couple of years, and that's something we obviously pay attention to. Key decision makers in the workers' comp world, you kind of see it broken down by executive level and then the Senate and the Assembly. Again, when you're looking to engage on these issues, these are the folks whose dials you want to turn and whose knobs you want to tweak and try to influence. So obviously on the far left you have the administration, starting with Governor Brown. Underneath him is Labor Secretary David Lanier, DIR Director Christine Baker, and then going down to the bottom there, Acting DWC Director Desi Overpeck. In the legislature, I think the 2 most important folks are the chairs of the relevant policy committees. Those are Senator Tony Mendoza and Assemblyman Tom Daly. Senator Mendoza obviously hailing from the LA area, and Mr. Daly coming from Anaheim, Orange County area. All right. Really quickly before we jump into the bills, let's talk about what's going on in California workers' comp really quick. I'm not going to tell you anything you don't already know, but it's good context for the conversation we're about to have. As you can see on the map of California, or the map of the United States relative to workers' comp costs, California has its own color. I don't know that I really need to say a whole lot more than that. We are such an outlier that no other state is the same color as us. We are brown, way over there on the coast, and there's not much disputing it. I know, there's been some questions about Oregon's premium survey and applicability to California and some of those questions, and that may matter around the edges, but fact of the matter is California is a significant outlier. All right, so why are we a significant outlier? One of the issues is we have a relatively high claims frequency. We have more injuries that end up as indemnity claims than other states. A larger percentage of the claims end up as indemnity claims. Median's 9.3, we're 13.6. I'm terrible at math, and I can tell you, that's a significant outlier. We are way above the median here, and it's not good. We have more claims, okay? And of the expensive variety, the indemnity claims. So that's where we start. So what's going on with that? What's going on? Is this a California issue? Is this a national trend issue? What's happening? You can see on the slide that's in front of you now, we kind of break it down by region. California versus other NCCI states. You can see right around 2010, prior to 2010, California actually tracks with the national trends, okay? Now, are we more severe in our declines or increases? Yeah, sure, we are. But when the nationwide trend is down, we're down, and when the nationwide trend is up, we're up. What you can see is around 2011, we started shifting to where the nationwide trend is actually in the opposite direction with regard to frequency, and California is kind of an outlier. What the smart people at the WCIRB tell me is that means that we are dealing with some sort of California-only phenomenon that is causing an increase in claims frequency. What it could be, what it's suggested to be, is the benefit increase that was associated with SB 863 in 2012. That would be a California-only incentive to file additional indemnity claims. So California frequency by region, considering that opening day for baseball was on Monday, we'll call this slide How Dodgers Fans Are Ruining the World. since we're up here in the north and around San Francisco. You can see that LA is basically the problem. We have a lot of claims coming in LA. If LA were kind of taken out of the California picture, we would look far different. But frankly, the LA basin has a frequency problem. Why? Well, there's more PD claims, more cumulative trauma claims. Those are our trends. We are seeing more. If you kind of get out of the charts and just into the description, we are seeing more claims essentially for skin and contents down in the LA basin. Cumulative trauma claims, back in my claims days before I was a lobbyist, I would say that it's basically a claim for getting old on the job. It's bilateral extremities, back, neck, everything in the kitchen sink. We also have relatively high medical costs in the state of California. So all of these things are swirling about, and they're causing us to be, frankly, a statistical outlier with respect to the expense of workers' comp insurance in the United States. And not just kind of an outlier, but a significant outlier. This next little pie chart is one of my favorite things to look at, and I find it incredibly disturbing. We spend about a third of the California workers' compensation dollar on expenses. And this is going to make sense to why this is a huge problem as we get later on in the slides, and we're talking about some of the bills that we're facing. But we're spending about 33 cents of every dollar just delivering benefits, or fighting over the delivery of benefits, or something of that nature. So it's a significant problem. I think our philosophy as an organization in the past has been that we want to take dollars out of that administration category and either put it back in employers' pockets or move it into the injured workers' pockets in the form of some sort of benefit, that gets them better and back to work. It seems like, at least for the time being, even though SB 863, the reform package from 2012, was intended to do that, that it hasn't actually done that. Maybe we're moving in the right direction, but for right now, this is still a problem. And then obviously, the Oregon study that we always like to talk about. Here's a little bit of a historical perspective. The LA Times is working on a story right now on the rate decrease in California, and I think they're going to try to make it seem as though it's a big deal for employers. But let's look at this slide for a second and just look at the Oregon study and say, all right, well, we may not be as bad as we were in 2004 when we were number one, right? We were 236% of the median workers' compensation costs. We're only 188% of the median now. But if you look at the trend, it's a bad one. Going from 2008 to 2014, we were 121% of the median, 131% of the median, up to 188%. So we seem like we're on track to be kind of getting back to the place that we were, at least with respect to our comparison to the median back in 2004. Hopefully, what we've seen recently out of the WCIRB recommending a rate decrease is a signal that maybe that trend, that cost trend, is starting to either slow or move in the opposite direction. But the data we have right now doesn't suggest that is true. Okay, while you're all here, the legislative aspect. So, what are we working on this year? First and foremost, I think it's important to recognize that SB 863, which was passed in 2012, is still being implemented. Okay, and it's frankly it's still impacting the politics of what we're working on now, and we'll talk a little bit about what that means. If you remember what was in the bill, it was a permanent disability benefit increase of about $1 billion, a little bit more, a little bit less. My understanding is that the target cost, the $1.3 billion, is probably come out to be a little bit low. That's not because we didn't understand what was in the bill. That's just because the scoring of that permanent disability increase anticipated a lower increase in utilization or frequency associated with the benefit increase. We've seen, as we discussed earlier, an uptick in frequency, which is causing higher utilization of PD benefits. The idea was to take the higher benefit costs that were being put into the system and offset it with reforms, cost-saving reforms for employers. I think what employers wanted going in was kind of a 2-to-1 savings, deliver benefits to workers, but also deliver savings to employers. I think really what we ended up with was a cost-neutral bill, a bill that was designed to pay for the benefits that were being provided to injured workers. And no matter what, that's a positive outcome. If you're an observer of the workers' compensation politics in California, what you've likely seen is severe pendulum shifts or swings, right, where the employers have it really bad and we do something severe like we did with SB 899, or the injured workers have it really bad and they do a large benefit increase bill that doesn't really take into consideration costs or savings. What SB 863, I think importantly signified, excuse me, was some collaboration among labor and management, a work-together attitude that was far more collaborative and thoughtful, and frankly helped avoid significant pendulum swing that we're used to seeing, and frankly helped with respect to workers' comp create at least some sense of predictability. So that's a very positive outcome. Okay, what do we have going on this year? This is the fun part. So first and foremost, we have 8305 by Lorena Gonzalez from San Diego, an assembly member from San Diego. This bill is dealing with apportionment to gender. In the past, if you've been paying attention, you would have seen a couple of bills that dealt with apportionment to all protected classes. The idea would be that apportioning to disability that was caused by an injury or illness where a protected class, either race, gender, or some other, where that person was predisposed to that condition would be unfair. Those bills have all been vetoed or killed in the legislature. What Assemblymember Gonzalez has done here is take kind of a portion of that discussion relative to gender, and frankly, she got a lot more specific than some of those previous measures, which makes the bill easier to understand, but no better, frankly. What this bill does is it basically precludes apportionment of non-industrial disability if it's the result of osteoporosis, menopause, pregnancy, or breast cancer. Secondarily, and somewhat separately in the bill, it says that you cannot apportion to non-industrial psychiatric disability if it results from sexual harassment or any of the conditions described above, so osteoporosis, menopause, pregnancy, or breast cancer. Now, we do understand that based on some of the work that we've done, some of the education we've done in the legislature and with committees, et cetera, that there are going to be some amendments made to the bill. We don't know what they are at this point, so definitely stay tuned to some of the resources I'll be showing you later, because this bill is going to morph. CCWC is opposed to the bill without a doubt. Why? It's precedent setting, and it's just unnecessary. The way that I try to explain this to legislators who will frequently get lost in the politics of gender, and righteously, I think, wanting to make sure that systems aren't inherently discriminatory. What this bill does is it intentionally transfers liability for non-industrial disability to employers. And there's just no rational basis to do that. It doesn't matter, I've attempted to explain, it doesn't matter why disability is non-industrial, other than that's how you establish that it's not the liability of the employer. It falls into one of two categories, industrial or non-industrial. Why it's non-industrial doesn't matter. It's just that it didn't occur at the workplace. It's not part of the workers' compensation claim, and it frankly shouldn't be the liability of the employer. Secondarily, this is a repeat. We've had this conversation. We've had a conversation about disparate impact of apportionment on protected classes, and the courts have been relatively clear that the system actually treats everybody the same. To the point that I was just making, we identify industrial disability, we identify non-industrial disability, and we require the employer to compensate for the industrial portion. Everybody is treated the same way. Again, the reason why something is non-industrial doesn't matter. So this bill will be coming to the Assembly Insurance Committee very soon. CCWC is obviously working with the committee and other folks in opposition to the bill, but you should really keep an eye on this one. My spidey sense, my political spidey sense tells me that because it's such a sensitive subject, it'll move easily through the process. Okay. AB 438 by Assemblyman Chu from San Francisco, dealing with benefit notices. So this bill is a little unclear, but what it does at this point is it essentially requires a couple of state agencies, DIR, DWC, and SCIF, to comply with a law that's known as the Dime Aleatory Bilingual Services Act. Essentially what that does is it requires the department to engage in this process where they study, and determine what are the 5 most common languages other than English that are spoken by those that are engaging with the department. So it's kind of something specific to the department. Hey, and the people that you're dealing with, what are the most common languages that they need in order to communicate effectively? What the bill does is it basically says that notices required to be sent to injured workers by DIR, DWC, and SCIF need to comply with this act. What current law says is that notices need to be provided in English and Spanish. Up until a few days ago, the bill contained a 1-year tolling provision for failure to comply. What that means is that any statutory or regulatory time frame or trigger that an injured worker would have had to meet, even if, say, it would have meant them losing benefits or something along those lines, tolls for a year and frankly doesn't count. That was ultimately taken out of the bill. CCWC, along with some others, went and met with the author and expressed some significant concern over that. And what we're doing at this point is working with the bill's authors to clarify the bill. What do they mean by notices required to be sent to injured workers by DIR, DWC, and SCIF? Are we talking about notices that are actually sent to the injured worker by the department? Are we talking about notices that are required to be sent to the injured worker by claims administrators through regulations of the department or the division? So we're trying to get some clarity on what exactly the bill means. What are the implications of the bill? What happens if a letter is sent out in the wrong language? What if a claims administrator wasn't advised that the letter was supposed to go out in one language versus another? Does this become a penalty issue for audits? Does it become an issue of granting authority over medical decisions to the WCAB instead of IMR? I mean, what if notices relative to delay and denial of medical treatment go out in the wrong language? What's the situation there? So we're going to be working with the author and, frankly, the department and the division to work out some of those issues. And I think what's safe to say right now is it's unclear where we will be once we have the answers to those questions. Okay. AB 511 by Mike Gibson from the Los Angeles area. This is dealing with public safety presumptions. So this bill does 2 kind of distinct things. First, it completely rewrites the statutes on public safety presumptions. And the issue there, and I'm not characterizing the rewrite one way or another, the issue there is that there's a lot of case law and experience that's buried in the current construct of the statute. And when you completely reorganize and rewrite it, what you're doing is you're opening up to the courts the ability to reinterpret those words in a lot of different ways. And I guess the best example I can give you is if you were watching the litigation on the 2-year TD cap, where the cap was imposed. The courts made a determination about whether or not it was included in whether or not 4850 time was included in the 2-year cap. Frankly, a lot of observers think that they got it wrong at the beginning. Then there was an innocuous change to the statute, and I know what it meant because I negotiated it with labor, and it basically was clarifying that the 2 years of temporary disability could be received, within a certain time frame of receiving the first benefit. There was some confusion about how that was being interpreted by the courts. We clarified it. It was actually something that was intended to benefit the injured worker. What the courts did is they came back in and they made a determination about whether or not 4850 time was included in the cap based on that statutory change, when that change had nothing to do with it. So all of that is just to say, when you rewrite complete sections of the labor code, we're opening it up to complete re-examination by the courts. So we need to be careful about that. The second thing that the bill does is allow a local jurisdiction to extend presumptions to categories of peace officers that are not currently covered by the statute. Now, they would do that either through a collective bargaining agreement or a local ordinance. Again, this bill is also likely being amended. We've been in several times talking to the author's office, and they've been receptive to our concerns, and we expect it to change. So what's wrong with the bill? Why is CCWC opposed to the bill? One, obviously, there's some anxiety over the rewrite. But two, there's actually no need to do make the change allowing for presumptions to be extended through CBA or local ordinance. Currently, under existing statute, local governments and frankly any other employer can already negotiate a carve-out with any labor union. And the carve-out can cover the methods and procedures by which claims are accepted. And frankly, that's what presumptions are about. So this is something that can be negotiated with labor unions right now, and we don't need this other provision. Secondarily, as far as we understand it, through discussion with our members, there's nothing that stops a local government from just accepting as a practice right now certain claims anyway. So a local government could just decide that any peace officer that has a pulmonary issue, for example, or a heart issue, we're just going to accept those claims. There's nothing compelling them to delay or deny questionable claims. So it's just a completely unnecessary component of the bill, and that's why we're opposed. And again, we'll be working with the author on what they're going to try to do next. We hope, obviously, that it's more productive than what's in the bill right now. Okay. An important bill for you definitely to take a look at, AB 1124 by Henry Perea from the Fresno area. This is a bill it's a very simple bill. It's about 2 lines long at this point. But it requires the division to establish a formulary for pharmacy products. It does not include specific details on what the formulary should look like or when these regulations should be completed. I think what you should consider this bill is a work in progress. We have an author that is kind of committed to a cause, which is establishing an evidence-based formulary to, first and foremost, make sure that injured workers are getting clinically appropriate medications. Okay, but secondarily, where possible, and where alternatives exist, less expensive alternatives exist, to make sure that payers are expending their resources relative to pharmacy in an efficient way. So it's the combination of cost savings and evidence-based medicine. It's a huge step forward for California. There have been analyses done by CWCI and others that indicate that depending upon how you do the formulary, you could save somewhere in the neighborhood of $100 to $400 million a year. And when you kind of look at SB 863 and kind of the cost-neutral characterization of that bill. This is something that could absolutely help kind of push the system in the right direction going forward. So we are working closely with Mr. Pereira's office and other stakeholders on this bill, and it will absolutely be a priority for CCWC this year. And one more thing I want to include, having talked to a lot of my board members about this bill and formularies generally, workers' comp just has a problem with respect to the high rate of use of opioids and other dangerous pain drugs unnecessarily. And this is, I think, largely seen by CCWC members as a way to help protect injured workers from, irresponsible prescribing practices. We're having a lot of folks that have to go and be weaned off of drugs and put through drug treatment programs when they didn't need the type of medication that they were getting. And it's detrimental to their physical and mental health and ability to get back on the job and come out of the other end of a workers' comp claim in good shape. So this is something that's very important to the association, very important to our board, and we'll be working aggressively on it this year. Oops, we're going in the wrong direction. Okay. AB 1170, this bill literally may be dead before I'm done describing it, so I'll go fast. This is confusing, to say the least. Basically what the bill does is it creates a temporary pilot program. What would happen is that the division would do a study and determine how much money agricultural employers spend on medical care and workers' compensation every year. They would then assess those agricultural employers based on their pro rata share of the marketplace or employees or however they're going to do it. They would assess them for that amount, throw it into a fund, and attempt to provide some version of 24-hour, industrial and non-industrial care with those dollars. On the downside, well, I don't know if that's on the upside, but further on the downside, what the bill says is, and if we didn't get it right and we run out of money, we can just keep coming back to you. So it's kind of an unfunded or an unlimited liability for employers to tinker with 24-hour care or some version thereof. It does appear to be mandatory for all of the ag employers, and like I said, there's no cost cap. So we're actively opposing the bill, but what I understand is that the author's office has realized that maybe this isn't completely cooked, and they are going to back away from the bill. Now that being said, there are some real issues with undocumented workers being ineligible for coverage under the Affordable Care Act. This bill is actually not sponsored by labor or anybody else. It's sponsored by the Nisei Farmers League. So it's actually agricultural employers that are sponsoring the bill, which to me says that there's a gap somewhere, something that needs to be filled that's recognized maybe by both employers and employees in this situation. And so we should pay attention to what's going on there because it could pop up in the workers' comp world in ways like this. So you may want to stay tuned there. Okay, next, SB 8 by Senator Hertzberg. This is not a workers' compensation bill, but I'm going to tell you why it matters, and I'll tell you why CCWC has concerns with the bill. What it does is it's really a single senator's desire to get to work on dealing with California's tax structure. Because if you've been paying attention to the budget at all over the past several years, you know that we kind of have a feast or famine tax cycle in the state. And we don't respond very well politically and otherwise to the financial volatility that we see as a state. Okay? So there's that problem right there. What this bill does in an attempt to deal with that is it takes the sales tax, it brings it down somewhat, and then it applies it to services as well as goods. Well, from a workers' compensation perspective, what we automatically worry about is the applicability of that sales tax to services provided in the workers' compensation system. You know, is this going to apply to copy service? Is this going to apply to legal, investigations, claims administration? What's going on? Where is this going to apply? Is your contract with your third-party administrator now going to be a taxable event at, you know, 6.5%, 7%? I don't know. But certainly a concerning component to the situation. You know, if half of the workers' comp system, or even the 33% of the workers' comp system that is services, right, administrative costs, if that became taxable, you know, that would result in obviously a few percentage points of an increase in premiums for employers, and it would just be kind of pulling money out of the system. So it's something that we're concerned about and we'll be working on with Senator Hertzberg this year. All of that being said, this bill stands roughly no chance of passing the legislature, and that is because it is still a tax, and it still needs a 2/3 supermajority, and the Democrats don't have a 2/3 supermajority in the legislature, and even if they did, there are a handful of moderate Democrats who would absolutely not vote for this bill because of the political liability in 2 years when they're running for re-election. So what Senator Hertzberg is doing here is starting the conversation and potentially queuing this up for a ballot fight in 2016. Okay. Next on the list is SB 48 by Senator Block from the San Diego area. Senator Block is attempting to do some harmonizing with NAIC standards. There's a couple components to the bill, but I'm going to focus on one specifically, which is licensure for independent insurance adjusters. In the insurance code, those are folks that are adjusting claims for a contractor, a third-party administrator. We are not talking about a claims adjuster that works for an insurance company or a claims adjuster that works for a self-insured, self-administered employer. This is specific to those third-party administrators. And what the bill would require is that those claims adjusters be individually licensed through the Department of Insurance. Now, this wouldn't reduce any requirements that are already in place for thorough training and continuing education. It would be additive to that. So CCWC is looking at the bill. I think there are definitely some concerns among some of our board members, you know, that we're going to be holding different adjusters to different standards in the statute, and we don't know that that makes a whole lot of sense. And also, you know, there are, like I said, extensive requirements for adjuster training and continuing education. I mean, it's close to 200 hours of training, a large portion of which has to be in class before a claims administrator can take a seat and work a desk. And the continuing education isn't insignificant. So there's a real question about the need for this bill. And I expect that CCWC will take a position here in the next several weeks. Okay, SB 542 Mendoza. There is no controversy here. This is a very simple bill, and it's a good bill, and I think it's one that we will end up supporting, although we have not reviewed it officially with the board at this point. What the bill does is it basically modifies the home health care fee schedule that was contained in SB 863. From what I've been told and the discussions I've had, folks feel as though the fee schedule was unnecessarily limited in its scope and really took away the ability for the division to promulgate regulations that were the most effective and fit California the best. So this is a slight broadening of their authority. Again, it's under review, but considering that it should help SB 863 get closer to targeted savings estimates, I suspect that it's something that we will ultimately support when it's time. Okay, SB 563 by Dr. Pan. He's one of a Sacramento native. This essentially requires claims administrators to disclose the payment methodology for anybody that's involved in the process of modifying, delaying, or denying a medical treatment request. What's behind this is the California Medical Association and other medical interests want to make sure that utilization review nurses and doctors don't have a sort of perverse incentive in their contract to deny care. So maybe there's a minimum denial threshold in a contract, and there's a reward or something along those lines if that threshold is met or exceeded. From what I understand, A, that's not likely, but B, if it were, it would be terribly uncommon. But what the bill essentially does now is require some sunlight with respect to that payment process. I think you can expect this bill to change significantly. Really what the issue here for the Medical Association is the entire medical treatment request, review, and approval process. And there was an informational hearing last year, or not last year, excuse me, a few weeks back, where the Labor Fed kind of came out and said, well, why don't we just get rid of utilization review entirely? You have IMR. There's no need for it. And you never know if that's the way this bill is going to go, the direction it's going to move in, but it's certainly possible. For now, CCWC is opposed to the content in the bill, and we will keep watching it in case it does indeed morph. Okay. Second to last, SB 604 by Isidore Hall on SIGA liability. This is essentially a bill that is attempting to get around SIGA's tendency to push their liability onto a special employer. And specifically what we have here is LA County sponsoring a bill that basically says, hey, listen, when we contract for a temporary employee and we contract away that liability, that should mean something. And that should still mean something if the entity that we contracted with for the employee goes out of business, or their insurance company goes out of business. SIGA should come in and pick up the claims in those situations because we contracted that liability away. SIGA, of course, in these situations where you have a temporary employee and a contractual relationship, if they can't, get the money from the contractual, the person that's contractually obligated, they always go after the special employer, and they win. So this is LA County and other local governments attempting to say, no, when we contract away this liability, we expect it to mean something. CCWC is in support of the bill. And we will be moving along with it through the process. Okay. Last but not least, SB 623 by Senator Lara. This is a really simple bill. We'll spend about 2 seconds on it. It basically clarifies that an undocumented worker is not precluded from accessing the UEBTF or the subsequent entries fund because of their undocumented status. And I guess my slide says it. Yeah, this is obvious. There's no reason to deny an injured worker access to either one of these funds for the simple reason that they're undocumented. So CCWC was happy to go support this bill in the Senate Labor Committee yesterday, and it looks like it'll move along through the process just fine. Okay. Okay. So, takeaways. What are we looking at? You've got some political components here. You've got some bills that we're working on. You've got, a lot floating around up there. So what's going on? What do we expect to happen this year? A couple of things. One, listen, Governor Brown is going to continue to support this kind of sense of general stability in the workers' comp system. If you've watched, he's been incredibly on point in his vetoes and his veto messages, frankly, he's been able to really kind of push back against some of the pressure from the legislature to overextend to a certain degree, and that'll continue, I believe. 2, the state legislature. Listen, it's a strong Democratic majority. It's going to continue. They're going to continue supporting organized labor and injured worker advocates. And one other thing I want to say about the legislature is they're going to keep introducing and sending bad bills to the governor. And that is because, very simply put, they don't have to stop because he does all of the hard work for them. They get the credit for carrying the torch for some of these interests. And ultimately, it doesn't hurt the state because the governor vetoes the bills. So there's really, it's kind of a zero-sum game for them. They get a check the box and help a constituent, but at the same time, they don't have the negative consequences of the constituent's bad idea. So I think what you're going to see is a continuation of this dynamic where, frankly, some kind of confusing and perplexing workers' comp bills are introduced on a regular basis. Finally, you know, medical interests are obviously going to continue pushing their interests here in the state. Employers need to stay engaged. And frankly, you know, I'm proud of our board and our government relations committee and our membership because I think we have a more engaged membership than anybody else. So let's talk about that for a minute. What can you do? How can you impact the process? One, I'm going to give you some tricks of the trade, some resources, some tools, and then I'm going to give you my email address, which I'm probably going to regret later because you're going to bomb me with emails. But let's start at the beginning. One, politics is local. So when you're dealing with that type of situation, figure out who your guy or gal is, and then make sure they know who you are. So you can see on your screen there's a little website called findyourrep.legislature.ca.gov, and you go in there, you punch your address in there, and it kicks up 2 names. 1 gives you your assembly member, 2 gives you your senator. You can see that at our office we are represented here by Kevin McCarthy, assembly member from Sacramento, and Dr. Pan, who was on our list earlier, if you recall. When you go to click, and hopefully you can see my mouse kind of scrolling around on the screen, you can click on those names and it'll bring you to their website, and there you can find out all sorts of information about them. Where's their district office? Where's their capital office? What committees are they on? What legislation are they carrying? What are they working on that's important to them? You know, what community events do they have coming up if you want to engage on that level and kind of get to know them. So it's first and foremost, you need to identify your people. Second, going back to the how can I impact the process slide, learn how to track the process. And I will tell you that even as somebody who does this on a day-in, day-out basis, it's confusing. And frankly, legislators and people like me who do this for a business, we don't make it easy on purpose. I mean, this is a game of strategy. It's a full contact sport, and sometimes it's intended to be murky. But if you have the right tools, you can find out what's going on. The easiest place to go to get all kinds of information is LegInfo, www.leginfo.ca.gov. You can do a lot of things on this website. You can find the bill you're looking for. You can search by author. You can search by bill number. You can change which year. I think the site currently goes back to the late 90s with respect to the bills that you can search. You can set bill alerts. So say, you know, Matt O'Shea emailed me about AB 305 just now. If Matt's really, from Safeway, sorry, not everybody knows who Matt O'Shea is. But if Matt wants to track a bill, he could go to LegInfo and he could find that bill and he could click a little spot at the bottom, I'll show you in a minute, and he can track it. he could see who's opposed, he could see who's in support, etc. You can also look at the amendments, you can review bill analyses from the committees, and you can track where the bill is in the process. So let's because I figured out how to take screenshots last night, let's look at the website. All right, so here we have leginfo.ca.gov. You will see some buttons at the bottom of the screen. One of them has bill information. When you click that bill information button, it takes you to a little search mechanism, okay? Now you can see up at the top, you've got the session. The 2015-16 legislative session is the current session. It'll obviously go back, right, 13, 14, 11, 12, et cetera. You can search both houses. You can search the assembly. And then you can go down here. You can search by the bill number, the authors, or frankly, keywords. If you want to search for apportionment, or if you want to search for, you know, Santa Susana Field Laboratory, another thing I work on. You can search by name. I will tell you that is an inexact science. So don't rely on that too heavily, but it's certainly an option for you folks if you want to be doing that. So you do that. You search. We picked SB 623 for the purposes of this little demonstration. Boom. There's SB 623. What you can see is on the side here is status, history. If you click on the status, that'll give you a lot of information. It'll tell you which committee the bill is going to be up next, on which date. If you click down here, you can see the introduced version of the bill in the PDF or an HTML format. As the bill is amended, it will provide a new line of links. So it'll say where it says introduced and has a date, it'll say amended, and then it'll have an amendment date. And it'll have a PDF and an HTML presentation of the language. Oops, let's go back up. And then below it, you can see where it says analyses. It'll have the Senate Labor Committee analysis. So when you're trying to figure out, you know, what the heck the legislature was thinking when they introduced AB blah-blah-blah, you know, if there's an analysis up, you can go in and, frankly, there's an explanation of what the legislature was thinking. Now, it may not be the most accurate representation of that, and it may, and almost certainly always does, miss a lot of the texture and the politics behind what's going on. But it'll give you a good, sound technical analysis of the bill. It'll have a list of those supporting and those opposing. It'll have their arguments and things of that nature. So it's a very useful way to be able to go in and track legislation, is this LegInfo site. You can also see down at the bottom there's legislative publications, and there's kind of links around to other things. One thing that I find useful is the California Law button, where you can just click on that, and then you can start looking up, you know, labor code sections or whatever you need. It's a list of current California statutes and provides you access to the entire state codes. Okay, so what else is available to you? Legislative websites. Now, these are generally going to be useless, and I'll go ahead and do the Senate, but there are a couple of tools in here, things that I go to regularly that I want to show you. First and foremost, you're going to get a feel for what's going on, right? You're going to know what's going on that day and things of that nature. But you can search. You can click the Senators button right up here in the upper left-hand corner, and you can get a list of your senators, all of the senators. I need to quit touching that button. Okay. I picked Tony Mendoza because he's the chair of the Senate Labor Committee, and conveniently underneath him was Senator Holly Mitchell, who's on the Senate Labor Committee. But again, this is where you're going to be able to go, and you can see, you can go to their homepage, you can contact them directly from the website, you can get their address and send them a letter, and you can do things of that nature. The other thing that's important is tracking the committees. So you can go in here and you can see which members are on the committee, and then there are links to their websites. So if you know AB 305 is going to Senate Labor, you know who you need to send your letter to if you're engaging in that capacity. You know whose mind you need to work on changing. The other thing that will be stored here on this website from time to time will be analyses and like white papers that are done in conjunction with informational hearings and things of that nature. So there's some good resources that are available to you on the Senate website. Now, I only put the Senate website up here because the Assembly website looks roughly the same, and it just would have been redundant. But the two websites are assembly.ca.gov and senate.ca.gov. And that's where you want to go if you're looking for information on the legislature. Okay. We would be remiss if we didn't talk about our new website. So very recently, CCWC revamped our website. Now, we did that, frankly, as a result of some independent contributions for our membership. I want to make sure to thank folks for that. We did a little fundraising effort, and everybody really stepped up. And I used to joke that our website looked like it came from the 90s, which doesn't sound very old, but in website terms, that's about as old as it gets. So it really did look like it came from the 90s. It was not highly functional, but we've done a lot of work on it. So here we are, the CCWC website, ccwcworkcomp.org. You can see the various buttons at the top. There's a lot there. I encourage you just to go and explore, frankly. And as a member, you should have gotten, and if you didn't, I hesitate to say email me when you find my email address, but we can make sure to get you your login information to access the members-only portions of the website. But there's an advocacy blog where we talk about what's going on in the Capitol. There are Capitol alerts and things of that nature. But a few things in particular for this group that's on this phone that wanted to talk about kind of what you can do to get involved more. If you click on the advocacy button at the top of the page and go to the legislative process overview, we've provided a very detailed overview of the legislative process, far beyond what I've said here on the webinar today, but it really does talk about some of the nuts and bolts and mechanics of how things work. And even as someone like myself who's not terribly process-driven, this is incredibly important to know for purposes of maneuvering within the legislature. Sometimes I think folks outside of the world have instincts which are good, but this is a very process-driven world, and it's frankly a bit unique. So understanding the legislative process is very useful. Second, under that advocacy tab, you also have a priority bills button. You can see kind of at the bottom of the page, the top, AB 305, right? So this is going to track, and you can see that it updates regularly, automatically. This is going to track all the bills that we are watching and keep an updated status on the website. We'll also be posting our letters on the bills and other things on the website. So my suggestion would be to take a nice long, oh, there's my email address. Take a nice long cruise around the website and get to know it. Okay, so here's where I probably do something I regret, which is give you my email address and say, send me your thoughts. And I mean it. I mean it. The only way that I do what I do is by getting good, strong feedback from our members. Now, I'm very lucky to have a deeply engaged board and a lot of folks in the membership that just kind of call me and check in or send me their thoughts or kind of do any number of things. But if you see something out there, or you see something in a bill, you see something that we haven't caught, I want to know about it. And if you just want to offer me your thoughts on a bill, I mean, honestly, I can't tell you how valuable that is to what I do on a day-to-day basis, which is go across the street to the legislature and talk to them about what's going on in these bills. So don't be shy. I will say this, I have an unusually high volume of email traffic, so I may not get back to you immediately, but I think you can be relatively assured that I have taken what you've said about any bill, printed it, put it in my bill file, and likely worked it into my letters and talking points as I lobby across the street for the association in the Capitol. Okay, questions. One of the functions that we have available on our website, which we frankly will not use all the time, this is a targeted capacity that we do this, is kind of e-blast with calls to action. Now, I think from an association management perspective, from a political engagement perspective, we don't want to pull that trigger all the time and get our members to the point where they're thinking, well, it doesn't really matter when I get these notices, you know, it's just an exercise. We're not going to do that. But frankly, when we've got somebody's back against the wall and an overwhelming response from some of our membership would turn the tide, we're going to pull the trigger on that. So stay tuned. That's something that will actually come to you kind of proactively from the association. It's not something that you'll have to kind of trip over and discover yourself. But be looking for that. Somebody asked if there is a bill that precludes doctors in the MPN from doing UR or IMR on other doctors in that same MPN. And no, I haven't seen that as of yet. I haven't even heard that idea, and now I'm just terrified. That's a really good question. I mean, an MPN, you know, you've got your boutique MPNs from your kind of sophisticated, large self-insured employers. But if you're under the Blue Cross MPN, you know, the Anthem product, I mean, you're basically every doctor in the state. So I think that would obviously create some significant problems, and I hope we don't see that. The good news is I honestly think if that was put in any of these bills, it would really help us secure a veto. So maybe we do want them to throw it in. That's the cynical lobbyist in me speaking. And I'll give folks a few more seconds for questions, but I'm not seeing any others come in. And frankly, we are about 3 minutes beyond our time. So with that, thank you for joining us. We will let you go. I think what you can probably expect is another one of these later on as we get closer to the end of the session. Don't lose my email address. We'll make sure to post this webinar to the website. If you need anything, feel free. Please contact me. Your input is always valued. And with that, have a nice afternoon. Thank you.